areas and enjoy the athletic career that you deserve. I am your host, Dr. Mike Matthews. Hey everybody, welcome to the Athletic Potential Podcast. This is episode 28, and today we're going to be discussing an interesting case that's got a few key findings in it that I think will help everybody. As a general overview, we talk about a case typically in the beginning. It's the last patient I treated prior to the recording of this episode, and then what we'll do is take questions from our audience. Now, if you do have a question for the podcast, you can access that question or ability to ask that question a couple different ways. You can go straight to the website, www.athletic-potential.com/podcast. There'll be a button there that just says Ask Mike a Question, and you just click on that. It'll take you to a form, and you can submit your question through there. You can also, if you're listening on Apple, you can see in our show notes that there's a link there. It says click here to ask Mike a question. You can go there and just click there, and it'll take you to the same form. So please ask your questions. We want to make sure we get any and all questions that are out there answered and some good information out there. So, all right. Well, let's jump right into our case for today. So today we're going to be discussing the case of knee pain in a runner. It's a 15-year-old female runner, and she'd been experiencing anterior knee pain or front side knee pain, like kneecap knee pain, for quite some time. And we ended up seeing her after she'd already seen probably one other clinician, it sounds like, and seeing a doctor, and then basically giving her diagnoses of either jumper's knee or patellofemoral pain syndrome. Jumper's knee is essentially patellar tendonitis, and then if we talk about patellofemoral pain syndrome, it's basically just a catch-all phrase for the fact that you have pain on the front side of your knee. And that it doesn't tell you much. You have to actually know what structures are involved to actually be able to diagnose that correctly, and then also then treat it correctly. And so that's one of the things that we're going to talk about today. So when she came in, I did a quick screen of it, and we discovered really quickly it really had nothing to do with the patellar tendon. She had no pain there. I could poke at it as much as I wanted to. She had no pain. So no pain in the tendon right in the front side of her knee. But she did have pain just on the inside of her kneecap that was more specifically there when I tried to move her kneecap around, or when she tried to extend her knee against resistance. Think like a leg extension. That produced a lot of knee pain on the inside of the knee. She had no trauma. There was no falls. There's no hits. There's no weird accidents, anything like that. Just started hurting her when she started to increase her volume in running more recently. Or sorry, not more recently, but months ago. And then she had noticed that she did some formal physical therapy, did some strengthening with it, and she noticed that it improved a little bit, but as her volume increased, her pain increased at the same rate. And so she got our number and information from a client of mine that we already had that was also in the running community, and she came and saw us. And we did an evaluation, and what we found was that she definitely had pain on the inside aspect of her kneecap that was likely due to the fact that her kneecap was not staying centered in where it needed to be when she was running. And a lot of people think this is what we call patellar tracking. So if you Google this, it'll probably say something like, if you have anterior knee pain with running, it'll say like, oh, your kneecap, your patella is not tracking in the right position. It's being pulled to one side or the other. This does happen. However, when we look at it, you have to understand why it happens. And the exercise she was given previously by the physical therapist, her previous physical therapist, was good in the fact that it addressed quad strength, which she needed, but it kind of missed one of the main things that she needed, and it wasn't that her kneecap was being essentially pulled to the side and pulled off the center of the knee. What's actually happening is the bones underneath the kneecap were moving out from underneath it. So I give a really bad analogy, and I'll publicize it here. It's not a good analogy, but a brief anatomy review of the kneecap and how it works. So the kneecap sits on the front side of the knee. If you look at the kneecap from the front, it's smooth over the front. If you look at it, kind of take the kneecap and you flip it and you look at it from the side, the top part, the part that's on the outside, is kind of a rounded shape, but the bottom part of it goes to kind of a cone. It kind of goes to a V. Those that are watching, you can see my hands. So the top part's kind of a flat part, the bottom part's a V part. And if you take the kneecap off the knee and look at where it settles into the knee joint itself, there's an actual like trough. There's a place for that V, that kind of cone to fit into the knee, and then it should just kind of run through that area. Now it's an overgeneralization, I know, but that's basically how those two joints come together, how those two bones come together. And there's cartilage on both sides, and so it's another joint. And what I tell everybody is this: look, imagine you're in a boat. And you're going down a canal. So there's not a lot of room on each side, but you're going down a boat in a canal. Like most boats, not flat bottom boats, I get it, bad analogy, but here we go. And that is, most boats have kind of that bow, right? It's kind of a scoop shape on the bottom side of the boat so that the boat stays on top of the water and can go through it nice and easy. And in a canal, it's the same thing. The bottom of the canal is kind of that same scoop shape. So as long as you're going down the middle of the canal in your boat, you're totally fine. You don't bump into the edges. You're not, creating damage on your boat. There's no wear and tear, and you're just kind of going straight down the boat or down the canal. Now, a lot of times when we talk about this patellar tracking, people have the idea that someone's essentially steering the boat from the center of the canal into the side of the canal and kind of banging up against the side of the canal and causing damage to the boat. And, in the analogy, the thing is that the kneecap is running into the side of the joint and it's causing this wear and tear and some pain in the knee. Now, there are certain situations where that is true. However, in a lot of situations, and in our situation with this runner here, there's something else that's actually happening. And now this is where the bad analogy comes in, all right? So the boat's actually going straight down the canal, and all of a sudden the canal moves underneath the boat. So the boat's still going in that straight line, but now the canal goes off to one side and essentially rams the boat from the side. Now, I know canals don't move unless there's an earthquake, and even then it's still different. But the idea is that underneath that canal, the trough, the bone that connects where the kneecap sits, it moves, it rotates underneath, and then creates essentially kind of a banging up against of the bone of the kneecap. And then what happens over time is you get wear and tear there, and then it gets irritated, and then you get pain. And in our runner's case, this is what's going on. And so she was given strengthening exercises by a previous physical therapist for quad strength. And this seemed to decrease her pain, which makes sense because basically what was happening was basically the canal was moving out from underneath the boat, and the boat was just essentially staying nice and firm in the canal, but it was still ramming the side, but not as much, which is why her pain levels went down. However, as her running volume went up, the pain levels went up because her wear and tear went up because it's not gone yet. And what we need to do is take the canal and stabilize the canal so it doesn't move underneath it. So in a sense, what we needed to do is teach her her hip not to rotate as much as she is running. And so without hip strengthening exercises here, she was never going to really get better. So we prescribed her what I kind of took from a mentor of mine, again, mentioned Dan John on my podcast. And he has this workout called a Butt Blaster 5000. And it's two exercises. It's hip thrusters, so laying on your back, and you lift your hip up. Hip bridges, glute bridges, whatever you want to call them, those. You do 15 of those. You have a mini band, a little small mini band, glute loop, whatever you want to call it, around the bottom part of your thighs, just above your knee. You do 15 hip thrusters, glute bridges, and then immediately when you're done with the 15th, you put your butt down and you start pulling the band apart into clamshells. So you're kind of taking your knees away from each other, and you do 15 clamshells, then you do 14 hip thrusters, 14 clams, 13 hip thrusters, 13 clams, all the way down to 1. We call that Butt Blaster 5000. There's no rest in between. You just keep knocking it out until all of it's finished. And it'll definitely make you burn depending on how tight your band is. And this is what we wanted to start with, because what we were trying to do is just basically get her glute maximus to fire better, and it just wasn't firing very well. And so we wanted to make sure that improved. That was the hip thruster part. But then we also wanted to train rotation. Now, one of the things I used to tease my students about this all the time is I'd ask them, hey, what's the main external rotator of the hip? And they look at me like, well, and they kind of go through these list of exercises, right? And eventually what we come back down to is it's the glute max. The big butt muscle that everybody can see on the backside, that is the muscle that controls hip rotation as long as it's within 45 degrees or less of hip flexion. So if your knee's up towards your chest, you have other muscles that are working on hip rotation. If it's further away from your chest, the more your glute max does rotation. And so these clamshells we're doing it right around 30 degrees or so, 40 degrees, not perfectly there, but they're targeting more of that glute max control of rotation as well as extension. And this is what we gave our running athlete. Now, that was the first visit. That was her evaluation. We determined this was what was going on. And we did two additional things. We gave her exercises. That was the first thing. And then we also did, I did some hip mobilizations because she demonstrated a little bit of hip stiffness, which I think was participating like in this problem. And so we mobilized her hip. We gave her the hip exercises and we said, good, I'll see you in 3 days. Let's see how you're feeling. Now, in the meantime, I need you to go out and run your normal volume of running that you would normally do. And in her case, it was going to be 3 miles followed by it was going to be 4 miles the next day, 2 miles the following day, back to 4 miles again, and then she'd see me again. And so she did that. And she came back to me and said, I had pain the first day on the 4s, I had no pain on the 2 miler, and then I had only pain at the very end of the 4 miler. Whereas previously she kind of had pain from about mile 1 to mile 4 during that run. So we saw a reduction in running pain, which is great. So we mobilized her hip again. And this time what I did is we not only worked on hip control, we worked on postural and pelvic control because she demonstrated a little bit of a sway back posturing, anterior pelvic tilt that I was pretty sure it was there when she was running. We haven't done a running analysis. I haven't videoed her running or anything like that. I just was trying to fix some basic hardware problems, so to speak, to see if we could get her to feel a little bit better when she ran. Then she was planning on running. That day she was taking the day off. The next day she was also taking the day off. And then she was going to run 2 miles, 4 miles, 2 and 4. It was kind of a weird format she was running, but she had her own program, so we were going to stay with it. And then she was going to return to us again. So on her third visit, she came back to us and she reported that she had no pain on her 3 mile run and her 2 mile run, and only pain at the very end of her 4 mile run. So I said, overall, are you getting better? Do you feel like this is improving? Do you feel like we're just hitting with a bunch of exercise and it seems to be improving a little bit more? And she says, realistically, she felt like she was definitely feeling better, but she was still having that pain with a higher volume of running. And we knew that she was going to have to run around 6 to 8 miles at some point. So we knew we needed to do a little bit more. So we gave her the Butt Blaster 5000. That was still going on. Then what we did was I added hamstrings in the form of hip hinging. So we had her activate her hamstrings a little bit more. And then we worked on a single leg hip rotation airplane is what we call it. Now, first of all, I have to say, if we're giving somebody hip airplanes, and if you want to see what that is, it's on my YouTube. You can go look at it there. Hip airplanes are very difficult exercise to do correctly. And they have to have a prerequisite amount of balance and prerequisite amount of strength to be able to accomplish this. And in her case, we did. And so she's got a fair amount of dancing background, which allowed us to be able to just kind of jump right into that. And we gave her hip airplane series, told her to do that every day. We told her to do the hip thrusters, the Butt Blaster 5000 every day, and the hinges every day. Hinges were right around 30 to 50 repetitions, no weight, just working on like getting into that range of motion and activating her hamstrings. And then we sent her back out for 2 more days of running, and she came back and said she had no pain with running. She was running 4 miles on both days. So we knew we were on the right path. And at that point, I basically said to her, I said, look, you need to go on the same program we're doing. We're going to add resistance to the hip hinging. We add it in, not in the fact that she was going to like deadlift, but more along the lines we put a band, a longer 41-inch band. We put it around her waist and had to pull her backwards. And then she had to hinge forward against it, really activating glutes and abs at the same time to kind of get that nice tall plank position at the top. And what we had her do that for 5 days and continue to run. And she was able to run 6 miles, no pain. And she came back to us for her fourth visit. And she told us, look, I don't have any pain when I run right now. I've ran 3 days in a row. I've ran 4, 6, and 4, and I've had no pain. I said, sounds like we're on the right path. Keep going, and let's see how this goes. Now, as of her, the last time we spoke with her, which was just more recently, she said she's 100%. She says she can run. She can do everything she wants to be able to do. The one caveat is she has not tried to run in a race, and she has not run on anything but flat, straight, and like a track. She hasn't tried to run. She'll eventually run cross country. She'll eventually run longer distances in track and field, usually the mile. And she even talked about maybe trying to do kind of an 800 this year. But we haven't seen her at the highest levels and higher levels of stress. But what we do know is on everything that we just did, those things helped. And she's able to run without pain. So those that may be listening that have had pain with running, understand that, one, correct diagnosis really helps you understand what exercises you need to be able to do. But I can tell you this, and there's a rare time where I can say, oh, all of these exercises help everybody. I can tell you this, specifically in the female group, but in the males, this also applies. And that is if you're having anterior knee pain, pain in the front side of your knee that's specific to running, it can be sprinting, it can be long distance running, doesn't matter. If you're having those things, the first thing you need to look at is the posterior chain. That's hamstrings and glutes. You need to get those back in line. If they are already in line and 100% and really pretty good, and you're still having knee pain, then we need to look at volume of training and then also maybe the way you run. But I can tell you right now, Butt Blaster 5000, okay? If you're not doing that, jump on that, get going on that, and then hinges specifically resisted with a band around your waist, right around the 30 to 50 repetition. Do that daily with 2 rest days throughout the week. The framework we were using with our athlete here is that she would not do any of these exercises on Wednesday because that's also her lowest volume of training day. We really wanted kind of like an off day in the middle of the week. And then she would also not run on Sundays. And so we had her not do it on that day. Every other day, she did these exercises. Now, she always did these exercises after she ran, not before, unless she was going to run late in the evening and we had her do it in the morning. So, Butt Blaster 5000 and hinging, specifically resistance band behind you. If you want to look at those you can look them up on YouTube and take a look at it there. But it's kind of something that we've noticed has worked specifically with anterior knee pain for that specific reason of that there's too much rotation happening at the hip and that's causing problems down at the knee. So, all right. Well, that does it for our case. So we're going to get right into our question and answer session today. And our first question comes from James. James says, what are your favorite core exercises for your athletes? So, James, this is a terribly broad question. I can tell you that. And so I'm not sure how to answer without really having to maybe provide some stipulations on this so that we can kind of understand. So the type of athlete really dictates the type of core training. Now, I will go into this, and the reason why I didn't answer this question is just more specifically for you, James, is I think it kind of comes with a really good message for everybody, and that is this. There are certain core exercises that we do not perform, or we only perform on an extremely individual and very infrequent basis. Now, those are the ones that everybody knows about. That's your sit-ups and your crunches. And I know I'll get somebody that says like, no, well, this is why I use them. They're amazing. They've helped me a ton. Good for you. That's the case. Like that's great for you, and it's worked. Just know that there's some substantial evidence in regards to core or into disc pathology or disc pressures or disc forces in regards to sit-ups and crunches that may not be very good for a lot of our athletes. May be great for you, but not for athletes. Okay. And so we don't prescribe. I haven't prescribed a crunch or a sit-up in years. And not that I hate them. I should say I prescribed a reverse. What do we call it? Man, we call it a reverse crunch. I don't think we did. We call it something else, like a reverse lower. Essentially, the legs were out straight. We had them hold their spine as straight as they possibly could. They held on to something behind them. They're laying on their back, and they brought their legs all the way up. Looks like a pike, but they bring their legs all the way up. But they keep their back as flat as can. They're flexing at their thoracic spine, kind of like bad posture at the top, and they're slowly lowering themselves down in that position. And the reason why we're doing that is because they really had a hard time controlling their core, and their sport kind of required it. I believe it was a diver that needed that. I might be wrong. But anyways, so that was more of a specific, if you looked at it, like, oh man, that kind of looks like a reverse crunch or a reverse sit-up. That was about the closest thing we've done to a crunch or a sit-up in a long time. I can tell you this, that almost all of our athletes do 3 specific exercises, the big 3 from Stuart McGill. I feel like they're highly effective, but also not that easy to do. So the 3 that we teach are the curl up, you can look at the YouTube, this bird dog, which you can also look at my YouTube, and the side plank. Those are the 3 that we have almost all of our athletes do. They've been shown to have tremendous benefit across a broad spectrum of athletes, as well as workers and like I think combat athletes and like firefighters, policemen, army, military, that kind of thing. And so I can tell you those are highly effective and a good idea. So we have most of our athletes doing variations of those. We do a lot of planks. We do a lot of side planks. We do a lot of, like Palloff press. You can Google that. But it's a band coming up from one side, or even a cable, and you push it away from you, and it's trying to rotate you. And so we're trying to maintain no rotation and using the muscles of the core to be able to do that. That's how we train the core. In our youth athletes, what we found is teaching them posture first is kind of the key. So we're teaching them basically what normal posture position, pelvic position looks like, and a lot of times we're doing pelvic tilts with this, we're doing curl ups with this, we're doing standing, reaching without letting their back move. That's what core training really looks like for most of our athletes here at Athletic Potential. Trying to think of any maybe little subtle caveats, James, that I might be able to help you with. So I gave you the 3 that we give with everybody. Planks, just normal planks on your hands, planks on your elbows. Superman, so if you have TRX straps, think like ab wheel, but using suspension trainers. We really like Supermans. There definitely comes with a prerequisite amount of coordination. If you don't have it, you need to get that before you really get into those. But those have been highly effective for most of our athletes as well. And it gets a lot of additional things, shoulder stability, core awareness, those type of things. So those would be things that kind of think about as well. So James, I hope that answers your question. It's a good question. And I hope I wasn't too broad, but maybe that's kind of what we needed at this point. So, all right, next question comes from Shauna. She asks, how would you recommend you train your athletes for cardiovascular endurance, specifically your throwers? All right, endurance training. Oh man, let me just give you all the names. So we've got cardio, we've got cardiovascular endurance, we've got aerobic training, aerobic endurance. You've got energy. What do we call it? Energy systems development. All these things to say the same thing in a lot of ways, and that is your ability to pump blood throughout your body to the muscles that need it, and to do it in a sense over certain periods of time. Cardiovascular endurance. It really depends on what we're talking about, what kind of sport we're talking about. If we're talking about a runner, like we did in our case, it's a different type of cardiovascular endurance than, say, our throwers. Now, you're asking specifically about throwers. So if you look at our throwers, specifically our pitchers, both softball and baseball, we're not having them do a ton of like steady state, low intensity cardio. Here we're having them do more explosive type movements, sprints, interval training where they'll, I think I've mentioned in a previous podcast, they do like a box. So we do, I think it's like 20 yards, maybe it's even 30 yards, 30 yards and then 15 and then 30 and then 15. What happens is they're doing something different on each part of that. So we work on athleticism on the 15 yards. We look at more sprints, higher end speed type movements on the 30 yards. And what we've noticed is, and they do that continuously. They just kind of keep going around and around. We kind of stop them halfway through and let them go the other way. So we're not, NASCAR turning left all the time. But the idea is, what we found is that is probably the best way to train our athletes cardiovascular endurance wise. High intense, slight decrease in activity, so it's intervals essentially is what we do. I can tell you last year, and we were with our pro athletes when we had a bunch of pro guys in, we would do the box method, and then a lot of the days we would do intervals with sled push. And what would happen is we pair everybody up, put 2 people on each sled, and put whatever weight we felt like worked best for them. And essentially they had 20 seconds to push the sled, as far as they could. And then their partner, and then what we did was that their partner then had to push the sled. They'd go 20 seconds, the partner would then go 20 seconds, and it's give and go, give and go, give and go, give and go. But the thing is, the partner would push it as far as they could. The partner would then push it back the other direction as far as they could. And this little partner battle, back and forth, back and forth, back and forth. And we kind of just see what, who made it further than the other person, who could push harder. It's just kind of nice little, era of competition. It's always good to kind of do that, and it increases the intensity without really having to try and get people to increase intensity. So we would do that quite a bit. To be honest, we ran football routes. Like I would just be all-time QB, and I would have guys kind of run back to me. They'd run out, they're not defended, and they'd run out. I throw a pass, they catch it. I'd have another football. They'd run while the other guys are running the football back in. I'd have somebody else going out. We pass there, and what happened is they get like 10 to 12 routes. Maybe sometimes 15 routes, and not a lot of rest in between. And there was no route under 10 yards, and so we had to run hard, at least for 10 to 15 yards. And then a lot of times we put it out to them, or have them cut hard, and just trying to keep them athletic. And so that's always a fun way to train your throwers in regards to like cardiovascular endurance. I always want to make that fun. It can be a grind. It's no fun when it's a grind. But the idea is, why make it a grind when we can make it fun and interactive and still get more, and to be honest, we get better benefit out of it when we do it that way. I think that's how we train our for cardiovascular endurance with our throwers. Intervals, hard and fast. To be honest, it's a great opportunity for them to become athletic. Throwers, are specifically our baseball softballers, they're really good at those specific movements and of throwing. And so what we try to do is just increase their athleticism by, maybe like trying to have them, go catch a ball or run to certain cones in certain times, or again, the intervals, give and goes, and like a little bit of competition. So that's the way I like to train our throwers, Shauna, in regards to cardiovascular endurance. And to be honest, we probably got like 10 more methods that we can use. General principles would be this, more of an interval training than anything else. 10, 15 seconds on, 15 to 20 seconds off. 30-30, that would be a good ratio. That's a hard ratio. Sometimes 20-40 seems to be best because they can go really hard in 20 and then 40 seconds where they kind of get kind of recovered. We have a lot of different variations with that. I try to keep it around those interval type training, and then try to make it get them athletic, make them do something that they're not really great at, but also makes them a better mover, a better athlete. I think those two principles, if you follow those two principles in regards to throwers, I think you'd probably do just fine. So they don't need a ton of long distance. If anything, they don't need a lot of long distance at all. Cardiovascular endurance, I know there's a proponent that still believes in that, and that's not a bad thing. I think there's some athletes that do it really, really well. There's some athletes that just need it because, to be honest, they just don't have much of an aerobic base at all. They're quite out of shape and they need it. But to be honest, you can still accomplish that with the ways we just talked about. So Sean, I hope that answers your question. So all right. Well, that does it for episode 28 of the Athletic Potential Podcast. I really appreciate everybody tuning in to listen to these. If you have questions, again, go to the website or click on the link below in your wherever you're listening to your podcast. Ask your question. We want to answer as many questions as we possibly can. It's always fun to answer it and see what we can come up with in regards to some things to give you some strategies to help you guys achieve your full athletic potential. We appreciate you tuning in. Please rate and review the podcast, and we'll catch you next time. Thanks.